We got home and had a wonderful nurse, Matt. He was like an angel that came in and showed us the ropes. And they learned together how to take care of Mom, because she was then bedridden actually for 3 full years. Dad took total care of her bathing needs and everything that. And then when it came to the end, and we had a beautiful last days with Mom, and she died here with him.
We were unsure about everything that was going on with my sister at the time. We didn't know anything. And they were just very calm, the way they treated us, very dignified, you know, even at our worst hours.
And Grandma really took a turn. She kind of held herself strong for Grandpa all these years. In fact, that's what she always said. She was staying alive to take care of Grandpa, make sure nothing happened to him. Well, he passed away, and she didn't feel she had any reason to be, and she's failing.
When we knew that we're going to have to bring my brother to a facility, there was initial trepidation. I could never repay them. There's no amount of money. There's no amount of thank you. It's phenomenal, and it's systematic here from the volunteers, the nurses, the doctors, the people that came and clean the room up every day. It's like they can't do enough for you. They treat you like your family. They go out of their way to help you and make this transition comfortable. And they not only treat the patient, but they treat the entire family.
The hospice team, the St. Francis Hospice team, is just my lifeline. They come every week and they talk to me about everything from Grandma's health to what we can do to make her more comfortable, but they're also my support completely.
Our program started about 20 years ago. It really started because there was a gap in our community. There were a lot of people who weren't receiving end-of-life services. We started with about 10 employees, and now we have over 300 employees. And we used to serve about 100 people a year, and now we serve over 3,000 people a year.
Catholic healthcare is a healing ministry, and healing doesn't always take curing. It takes, healing is about taking care of the whole person, spiritually, physically, and emotionally. And hospice does that.
Really, it's grown step by step because of the commitment of all the staff and all the volunteers who are part of our organization. I think we all feel compelled to do this work. We all feel a calling to do this work. And so we put our heart and soul into what we do each and every day. We
have the best team. We have the best team of caregivers here. The housekeepers, you know, the dietary workers, you know, the facility guys. They know that this is a great place, and it's only great because of them.
The program originally was designed to be in physicians' offices, and the physician would refer the patient to using the question, would you be surprised if your patient you're examining were to die in a year? And if you're not surprised, then refer the patient to palliative care.
Asking this question forces the doctor to focus on the severity and the urgency of his patient's illness. It's a unique example of how we identify patients earlier in the healthcare process.
By doing that, we have changed many physicians' behavior. Patients are more likely to accept a hospice referral when we've prepared them, and we've also received their advance directives. They've told us what they want and who they want to speak for them, and we get all that done ahead of time. So you can see it can be a fluid continuum of care.
It's not only the physical care and the medical care that we give that is getting ever more complicated today as our patients are living longer, coming to us more debilitated than ever, sicker than ever, and we're really challenged to manage their symptoms.
We were the first program in the country to be able to offer art, music, massage, aromatherapy, and hypnotherapy to all of our patients. Those services brought life to our patients in the midst of their illness. to be able to be touched, to listen to their favorite music.
My name is Charles Horn. I am the Multicultural Coordinator with Franciscan Hospice and Palliative Care. When you meet these families that are culturally different, traditionally, historically different, like I said before, with fear and concerns and anxieties, when they don't have a concept of hospice, we go in and you had to learn to listen, because we go in with a preconceived notion of what we think is best, and we really don't. I need to be a voice for people who do not have a voice. So when I go in and meet them where they are and provide them what they need, which is in this case hospice and palliative care, that we've accomplished our goal, because then we're connecting on every level through the culture, tradition, and history.
We have a SOUL program which encourages young adults and teenagers to volunteer in our hospice and palliative care program.
There's so many things to talk about. They talk about their past and what they wanted to do and their hopes and dreams, and then they kind of go off and ask us, oh, what we wanted to do, and we just talk about that. It's really great.
We communicate with doctors and emphasize the need to contact us early. Our program is designed to address the needs of patients and families before pain and physical illness clouds their decision-making. Doing this ahead of time helps them with their end-of-life needs and gives patients a chance to address emotional concerns, fulfill their dreams, and say their goodbyes.
And so we all work together. Not one of us could do any of this alone. We have to be part of this big team where everybody provides care.
I can't quit my job to be with him, and we can't afford to hire a nurse. He doesn't have that kind of money, and so it's a wonderful program.
They're very good about the end of life. They tell you exactly what's going to happen.
Personally, if I was in a situation like my brother, that this is where I'd want to be.
And they've managed Grandma's care so much and made her so comfortable. I don't know how people do without this kind of support